from the point of view of motivation and aims, it was basically the need for me to prepare something that my students can use in a classroom situation. I started teaching medical English in the 1980s, and I built up a large bank of material which I wanted to put to use for other people. People were coming to me for advice about what to do, and there was obviously very little published. There were some things published, but the expertise that was required to teach this kind of material was quite difficult to develop. So I decided I wanted to publish something that was could be useful for other people as well as myself and for the students. So that was the aim behind the writing. Well, they're suitable for, in a broad sense, for advanced nurses and doctors, and perhaps even other health professionals like pharmacists, because they now have to talk to patients, and as they have done throughout the world, giving advice about medicine, medication, etc. The pupils aimed at can be divided into different groups. One of the groups is obviously students learning medical English while they're doing their degrees, because a lot of medicine throughout the world is done in English, because most of the main texts are in American English or in English. And of course you've got the main medical texts from Oxford University, the handbooks, which are a gold mine for people studying medicine. So the English is the medium of medical communication in most parts of the world. So as students are preparing, they might be more focused on the written aspect rather than the spoken aspect, and it's a big shock when they come into the into the English-speaking world, where they have to take this like dead language, which is on a page, and then activate it. And students might have a vast vocabulary, but they can't use it. And then in the work situation and in the exam situation, the same applies. So the skills that are required for studying and students preparing to work with patients are the same skills that are required for exam situations, i.e. OSCEs, which are the main exams where the clinical skills and communication skills are tested. And then in the work situation, it's the same skills throughout. So it's actually quite easy to develop the strand. They're quite discrete, and this is quite important in ESP, where you're teaching very specific discrete skills that people can master and then develop. It's much easier to do this than just to do a general course. But until people have the expertise of it, it's quite daunting. But once you've done it, it's there. So the skills go across the books. The skills go across studying, exams, and working. So it fits into all of these. Medicine, quite often, people are studying it from the reading point of view, perhaps writing, but primarily reading. And there's not much contact where they're speaking to patients and to other health professionals. And although there's this vast vocabulary, this is not activated from the communication point of view. So students who are preparing to talk to patients, they need to be able to have the language and the skills necessary. And the same is true for advanced nurses and doctors who have already qualified, because they will maybe need it for exams and also for working in an English-speaking environment, and also if they're working in an area where there are lots of tourists, etc., then it is also important for them.